Infertility is a very sensitive issue, and many couples struggle with this medical condition. And you know, it has so many repercussions. It has such a great impact on a relationship and also on how individuals see themselves. So today we will be unpacking this topic, and I believe that it's going to make a big difference in your life. This is the Dr. Tebz Show, where we're putting your health back into your hands. Today, to discuss this topic with me, I have Dr. Saleema Nosarka. She's a qualified obstetrician and gynecologist and also a reproductive medicine specialist. I'm so privileged to have her here with me to discuss this topic. Thank you so much, Saleema, for joining me today.
No, it's a pleasure for me to be here and share my knowledge with everybody.
Yeah.
Because I think this topic is very important and becoming more and more common, the problem.
Yeah, and in some situations, some people don't even want to talk about it.
Yeah, that's true.
Yeah, so can you tell us, what is infertility and when would you say a couple is struggling with this now?
Okay, so we define infertility as the inability to conceive after 1 year of regular unprotected intercourse with the same partner if you are under the age of 35 years old. If you are over 35 and you've been struggling for 6 months, then we say get help sooner. The reason for this is because as you get older, you know, we use 35 as a magic number.
Okay.
As you get older, your egg quality is declining, so your chances are less.
Okay.
Yeah.
All right. But, when a couple is struggling with infertility, where can they go to, find help? Is it in government settings or only in private?
So it depends on if they have private or if they can afford private. But in the government setting, there are also clinics where people can get helped. So basically what happens is you first need an assessment. And another thing is that infertility is a couple problem.
Yes.
It's not just a male, not just female, it's both.
Okay.
And often we find that males shy away and there's actually a male factor. So, when you see the couple, it's important to emphasize this.
Yes, yes.
So what do we do?
Yes.
There are many things that a woman can do. I say we normally focus on the woman first because,
Yes.
then once that's sorted and everything's normal, then you can tell the partner, okay, look, she's fine, now it's your turn.
Yeah.
It takes two to make a baby.
Exactly, exactly.
Yes. So for the female, you need to take a good history and find out, are the periods regular? Are there any problems? Is there pain during intercourse? Looking for certain symptoms that would indicate a problem, for example, endometriosis, or maybe she's getting very irregular periods. So she's got something like polycystic ovarian syndrome.
Okay.
Then another common problem that we see is a tubal factor, where the patient has had a previous infection of the tubes. The tubes get damaged.
Okay.
So the egg and the sperm can't meet. And I think just to reiterate this,
Yes.
to have a baby you need a sperm and an egg, and they have to meet,
Yes.
fertilize, and then go and implant in the uterus.
Exactly.
So if the tubes are damaged, then the egg and sperm can't meet, and then they won't fall pregnant. So this is a big problem that we see, especially in people that have HIV or any other infections. But the problem with the infections is often they are asymptomatic.
Okay.
So they don't know.
Yes,
they don't know
yes.
that they've had the symptoms. They're
Okay.
fine. And then when you actually go and test, where you do an X-ray to check if the tubes are open, you see, but the tube is very enlarged. It's filled with toxic fluid from the previous infection, and they didn't even know about it. And in that case, you'd have to first remove the tube, because if they do fall pregnant, then there's a chance that the embryo sits there, and then you get an ectopic pregnancy. And that's not compatible. Ectopic is where the pregnancy is not in the uterus.
Okay.
And eventually, if it gets bigger, the pregnancy, it will rupture. And that's a medical emergency. So what else we can do is we can scan the patient, look at a uterus, see, is the uterus normal, the shape? Are there growths in the uterus called fibroids or myomas? If it's sitting inside the womb, it can prevent the embryo from implanting.
Okay.
Sometimes the woman has lots of fibroids, they're very big, and like 5-6 centimeter size, and she actually looks like she's pregnant, but she's not. So in that case, you'd have to remove all those fibroids before she can conceive. Then also you look at the ovaries.
Okay.
If the ovaries have 10 to 12 small little circles, like we call them cysts, but I don't like to use the word cyst because when you tell a patient cyst, they immediately get panicked and they think, oh no, the cyst's not going to go away. But it's called polycystic ovarian syndrome, which is where they have multiple cysts on the ovary, they have irregular periods, their blood hormones are abnormal and they don't ovulate. So they will tell you they have a period every 3 months maybe, or every 2 months, and then the period stays away, then it comes back, then it stays away. They put on a lot of weight. They're not eating to death, but they just can't seem to lose weight. They're very hairy, you know. These are all, and it also goes with anxiety. So this is a very common problem we see, and in this case you need to then check the glucose levels, check the insulin levels, maybe put them on medication to control that, and then give them medication so they can get regular periods, and then they can try to fall pregnant. I'm just thinking age. Age is very important. We say if you haven't had a kid if you're single and you haven't had a kid by 30, you should freeze your eggs. Now, what is egg freezing? It's where you do a procedure to make a few eggs and you freeze them. And then in 5-10 years time, when you meet the right partner or you're ready because maybe your career is important now, then you can use those eggs. So say you try at 40. You've got a 32-year-old's eggs, whereas if you're trying at 40 with your own eggs at that stage, your chance to fall pregnant is maybe 15% or 10%. Whereas at the age of 32, maybe your chance is 30%. So I think people aren't aware, but people are becoming more aware. And in that way, you know, you have your insurance policy, so when you are ready, by the grace of God, it will happen.
No, true, definitely true. Sure, that was a beautiful, comprehensive overview of what causes infertility in women. But in men, because as you said, it takes two to make a baby.
So in men, there are these infections. People just have genetic problems. They don't know about it. How you test the man is you do a semen analysis. So you wait 3 days, no intercourse, abstinence for 3 days, and then they produce a sperm sample, and then they look at different aspects of the sperm sample. They look at the amount of sperm, so that's the count. Then they look at the motility, how the sperm move. Because obviously the sperm have to swim to get to the egg. And then the third thing is the morphology, which is the shape. So what the people in the lab that are actually looking at the sperm, they look at the shape, the head, the neck and the tail, and they see, is it completely normal? And then they count 100, and then they give a percentage out of 100. Less than 4 is a poor pattern, 4 to 14 is a normal pattern, a good pattern, and more than 14 is a normal pattern. Now again, when you tell this to a man and you tell him your percentage is 3%, that's very bad, 3 out of 100. But if his count is 250 million, there are lots of hundreds in 250 million. Whereas if his count is less than 1 million, and there's only 3 in 100 that are normal, that's a problem. And then they need assisted reproduction like IVF, in vitro fertilization, where you go and find the good sperm under the microscope. And then under the microscope, you go and inject that sperm into the egg. So the problem is if the sperm can't swim, it can't reach the egg. If there's not enough sperm, it can't reach the egg. If the shape is abnormal, it won't be able to penetrate the egg. And this is why you need to check these things to see if there is a problem and if you need assistance. Another thing, that I want to add is smoking and drinking also doesn't help. So men should, if you're trying and if you're smoking, you should cut down. I mean, for women also, we know, you shouldn't smoke and be pregnant. But for men, smoking and drinking, and also in the past where guys were using supplements for, for bodybuilding. But I think these days people are more aware. So the supplements that are on the market they're not going to harm the sperm. But in the past, like I had a bodybuilder once, and he was huge. He had these big muscles. And when we checked his sperm count, it was very low. And once he stopped the supplements and he went on to vitamins, zinc, folic acid, vitamin E, the sperm actually, the amount improved. So then they were able to conceive.
So wait, I know this isn't one of the questions, but as you're mentioning the zinc and the folic and all of that, so there are supplements that people can take to help them fall pregnant.
Not to help him fall pregnant, but if the guy's got a low count, he can use the vitamins to help.
Okay.
And for women also, when you're trying, you should use folic acid, because especially if you're older, you have a chance of congenital abnormalities. So, you know, you want to rather take it before the time, when, like, preconceptually.
Yes. In your experience, what are the big major causes of infertility that you've seen in our population?
Okay. So for women and ovulation, that means inability to ovulate. So that's the polycystic ovarian syndrome type, where the women are hairy, they don't get regular periods, they put on a lot of weight. That's a very, very common cause, because if you're not getting a period every month, you're not releasing an egg, and you will struggle. That's a big one. The second one is a tubal factor. Like I mentioned, if the tubes are damaged, either they're swollen or they're blocked. So the tubes can be blocked in two places. Proximally, which is where the uterus is connected. So if I always say use my hand as a tube. So basically, let me explain. Use the vagina is my legs. My body is the uterus. So the sperm's got to come in, and it's got to swim to the tube, because the ovary is at the bottom and the egg goes from the ovary into the tube. So if the tube is blocked at the distal part, the egg can't get in. So either it's swollen or it's completely, maybe someone once had appendicitis and there were adhesions, so all the tissue was stuck together. And instead of sitting like this, the tube was sitting like that. So the egg couldn't get in. We did surgery, we opened up loosened everything, and soon, like a few months afterwards, she got pregnant. So that was so simple. That's a simple thing, but you know, you have to check. Then obviously if the sperm is coming in and it's blocked proximally, the sperm can't get to the egg. And in that case, you then have to go and do assisted reproduction, where you have to take the egg and the sperm outside the body in the lab and mix them.
Because then you can't obviously operate that.
No. So tubal factor we see very commonly, especially with people that are HIV. Now HIV is not a reason not to have a baby.
Of course.
But your CD4 count should be good, and your viral load should be low. You should be on medication. So if you want to have a baby and you're HIV, it is possible. You just need to get the medical side sorted out first. You know, years ago they were saying no, it's not, shouldn't happen. But if the guy is positive and the woman's negative, there's a procedure called sperm washing, where they actually wash the sperm off, because the actual HIV virus is not on the sperm itself. So when they wash the sperm, you can then use that sperm, and then the woman and the baby won't get infected.
That's good to know. That's good to know. I don't think a lot of people know that.
No.
Oh, wow.
People saw HIV as a curse, but I mean, the life expectancy is so good. The medication is so good. Medicine has advanced so much. So if you're HIV positive, it's not. You can have a baby. You can be healthy. If the one partner is positive, the other partner won't get infected. So there's a lot that can be done.
Wow. No, that's great. No, the only reason why, you know, I was asking about the different causes, and you did it beautifully, is talking about the treatment. So you must know that it's not as simple, I'm coming to the doctor, she's going to make me pregnant and done. So there might be options of, as you say, either supplements or surgery. So there's various...
Or medication to make you ovulate, And then also if, the other one I was saying, the fibroids. You know, if there's a big uterus with these little golf ball size, it's a muscular thing, but it's hard. It makes almost like a golf ball, and you get different sizes. If that is sitting in the way, say that is sitting inside the uterus, then when the embryo is ready, it won't grow, because that's going to be in the way. So that needs to come out. So there's a simple procedure called a hysteroscopy, where you can go in vaginally with this instrument, and you can look inside the womb and check, is the womb normal? Because sometimes the patients had TB, they're not aware, and there's adhesions like scar tissue inside the womb, and if that's there, they won't fall pregnant. So, you know, when you scan, you'll see some abnormality, you go and look, and then you just correct that at the same time, and the womb is normal and good for a baby.
Sure. It's beautiful. What you've said has just given lots of people, lots of couples hope.
There's always hope. I find also psychologically, it can be a problem, because you know, you get married, and now you're at a family function, and the families ask like, are you not having a baby? Don't you want babies? And you know, I don't think the family means harm. They're just now obviously excited. I mean, I had a similar problem when we got married. The one uncle would come and put his hand on my tummy and tell me, is there a baby there? And it's like, it's an invasion of your space. And, you don't want to be rude and disrespectful, but if people would just back off, so it could then cause problems between the husband and wife. Because maybe the husband's the problem, or maybe the wife's the problem, or maybe there's a problem on both sides.
Exactly.
And it causes a lot of anxiety. And if you're anxious, your immune system gets involved. And so when I worked in private,
yes.
I saw a lot of these type of patients that were very nervous and anxious.
Sure.
And I told them, go and speak to the psychologist, just get off your chest, because say you do a treatment and it doesn't work. The woman then is upset and you cry and you're like, why has it happened to me? Why can't I have a baby? And the husband's like, we'll just try again. Now, it's not that he doesn't care. It's just men want solutions. Women have emotions that control them, and they need to work through it. So, you want the same end goal, but you're not coming from the same space.
That's it.
So, I think that's also important.
Yeah. So the psychological aspect,
yes.
especially for women.
Yes, yes.
So, what are your closing thoughts on this topic?
I think infertility is very common. I think it's very important. It's a male and a female problem. It's not just one or the other. Sometimes
yes.
it's both.
Yes.
But I think there are so many things that can be done.
Yeah.
Age. Number one in a woman is the problem. So what I always tell people, if you're young, if you're not planning on getting married soon, if you're over 30, freeze your eggs. It's your insurance policy, Men don't have that problem so much. I mean, we see patients that are 60, 65, and they got a young 30-year-old, 35-year-old, and they're having twins at that age. And they just come and they come walking in there like they're a stud. But for women, it's not that simple. The other thing is also, if you're a young woman, you could have something like endometriosis, where you have painful periods and heavy periods, and then it also affects your egg quality.
Sure.
So it's not to say if you're young, you will fall pregnant. So I always say, if you see that there's a problem, rather go for help sooner.
Yeah.
People are scared, so they put it off.
Yes.
But remember, your clock is ticking. You're only born with a certain number of eggs. The eggs aren't all good.
Yeah.
So rather get help sooner, then you know where you stand. And then you can say, okay, this is what the options are. This is what I want to do.
Yes.
And we can wait a bit, or we can go for it. And then, you've tried everything. Because speaking as a mother, having a child, it's the greatest gift of all. And ultimately, I believe it's in God's hands. So just pray a lot also.
You must have faith as well, right? Thank you so much, Saleema, for joining me today. It's been
a pleasure.
Absolute amazing.
I hope I answered some questions and I can help people, to understand better and to seek help sooner.
Yes, no, you definitely have. And I'm sure a lot of people want to get in touch with you.
Okay, thank you.
And to you viewers, I want to say thank you so much for watching this episode about infertility. I hope that you've learned a lot, and more than anything, that there's help out there. So if you would like to get more information about this, please leave your comments and questions in the discussion box below, in the comments box below. And if you'd like to get in touch with Dr. Nosarka, we will leave her details below. And and remember to like, share, subscribe, and push the notification button so you know when we post our next episode. So until next time, please do take care of yourselves and take care of each other. And remember, your health is in your hands. God bless.